Hi, everybody. Thank you for joining us. We have a very special guest with us here today, Dr. Kristian Goulet, and he's going to be sharing some information and some knowledge based on his expertise. And I wanted to tell you a little bit about Dr. Goulet. He's originally from Ottawa, and he did his undergraduate degree with honors in biology at Queen's University in Kingston, and his medical school training was done in Ireland. He first started working with concussions, examining the prevalence in Irish rugby players, and he completed his pediatric residency training at the University of New Mexico. During this time, he began giving concussion presentations at the local, state, and national levels. He then went on to do a sports medicine fellowship at Harvard University, and during this time, he was again very active in the field of concussions, giving multiple presentations at the local, regional, and national level. Dr. Goulet is an assistant professor at the University of Ottawa and is a member of the Brain and Mind Research Institute at that institution. He is the medical director of Hockey Eastern Ontario and has a consultancy role with Hockey Canada. He is a member of the Canadian Concussion Collaborative, as well as the Canadian Concussion Network. He is a member of the International Health Advisory Team treating patients with Havana syndrome. He's on the Scientific Advisory Board for Brain Injury Canada, and Dr. Goulet also plays a very active role with the Canadian Pediatric Society Injury Prevention Committee. He's the medical director of the CHEO Concussion Clinic and the Eastern Ontario Concussion Clinic and the Pediatric Sports Medicine Clinic of Ottawa. His research interests lie in concussion education projects and the interaction between persistent post-concussion symptoms and mental health issues. We're very honored and lucky to have Dr. Goulet speak to us today. Thank you for joining us, Dr. Goulet.
Well, thanks so much for asking me to do this. I always love to kind of spread what I call the mental health and screen and the screen time Bible here, the gospel. So thanks so much for having me, and I hope people get something out of this.
Well, we're lucky to have you, and thank you. We're looking forward to hearing about it.
Thank you. So, well, again, thanks guys so much for having me. And it's kind of, I'm here to talk about mental health and stress and how screen time relates to this. And listening to my bio, you probably wonder kind of how this all happened. And, I'll kind of explain the progression of my practice and how I spend most of my days now treating kids with mental health issues, not just with concussions. But, what I talk to patients about is I really focus on, trauma, and trauma just isn't, physical trauma, emotional trauma. But for me, trauma relates to activations of certain parts of your brain. And hopefully at the end of this talk, you're going to be able to understand, trauma, stress, and how screen time exacerbates this and has a huge hand in this really mental health epidemic that we have in pediatrics, not only in this country, but really around the world. So yeah, just that was an up-to-date bio. So that was really good. I don't need to go through, anything here, but just to introduce myself as a pediatrician, and a pediatrician that works at the University of Ottawa Brain and Mind Research Institute. So, concussions and head trauma is kind of how I got into, the brain, but, my working with the brain has really brought me, into helping people optimize their mind. And we'll talk about the brain and the mind a little bit later on and how they are different, but how they work together. So again, my disclosure. So whenever I do these talks, we're supposed to disclose kind of certain things. And again, this talk began, 15 years ago with talking about just standard concussions, and it transitioned to, why some concussions are lasting much longer than what we ever thought was a reasonable time frame. And that was a really easy segue into mental health, because those suffering from prolonged concussions really are affected. Their mental health is really, really affected. And then just through practicing 7,000 concussions probably in my life, and treating lots of kids with chronic pain and ADHD and anxiety, depression, and eating disorders, you see kind of how things have changed and the role that actually technology and screen time has had. Because certainly what's happened in the last 6 years in my practice is not unique to people, the pediatricians kind of around the world that I speak with. Now, everything we do talk about is based on science. It might be a surprise for some, but it is backed by the evidence. And just as an aside, I do a lot of consultancy and presentations for certain drug companies, just talking about mental health and certain, how medications work and why they work, not only for anxiety and depression, but for head injuries as well too. And all those pictures are there when I deal a lot with head injury. That's why you'll see kind of there's a little bit of a head injury narrative that kind of is pervasive through this talk. But when I do this to make kids kind of see how, head injuries and try to make it real for them, I use an incredible amount of analogies that, since this isn't going to be a head injury talk, you're going to be spared to, but now a little of analogy can go a long way, that's for sure. All right. So what I'm going to do here today is describe the difference between the brain and the mind, and two theories that I think resonate really, really well with patients is what I'm going to do with you. So, whenever patients come in first time to see me, I'll spend often an hour, sometimes even an hour and a half with them. And I'll go through a lot of the same things with you guys today that I go through with them. And, they tend to tell me that it's very, very well received, and they get a lot out of these talks. So hopefully you guys will as well. So the general adaptation syndrome, the allostatic load are two kind of stress theories that I think explain things really well. So I'll go through those with you. We're going to talk about the stress response, or the fight or flight response, and how is that's perpetuated by screen time and basically society today, and why that fight or flight response is actually kind of a detrimental effect on our quality of life today. We're going to explain again technology's role in that. And then hopefully we're going to kind of go through some strategies, to help your kids and to help you guys hopefully, lead the best life that you can. So this is just a typical patient that I would see, right? 14-year-old female or male, but previously healthy, but really high level type A personality in the IB program, which means they're really, really smart, accomplished, volleyball, pianist, really motivated, wants to be a neurosurgeon, or they want to be lawyers or something really, really motivated. So they're really that go, go, go. Get what's could be considered a relatively innocuous hit to the head, right? No loss of consciousness, no amnesia. But geez, 6 months later, she hasn't recovered. She can't go to school. She can't even stand up. She can't even exercise, right? Without having this huge flare in her symptoms. And this was something that I kept seeing more and more of. And I said, this isn't right? How, can a relatively small head injury, a type of head injury that our species would have been getting for hundreds of thousands of years, if all of our ancestors would have had a small head injury like this and they couldn't function 6 months later, well, we'd be extinct. So something else is going on, not just the brain, right? And that's where my practice and my treatment of head injury had really transitioned from the brain to the mind. Now, there's not a test on any of this, but I just want to explain this kind of new field of study that, I'm kind of inching my way into, and it's called Psychoneuro Endo Immunology. And this hopefully is as doctory as I'm going to get with you guys today. But I just put this up here just to explain how our bodies and our minds, every part of them, interact with each other. And when psychologically you're affected, well, that's going to affect your brain. And your brain, when affected, it affects your hormones. And when your hormones affected, it affects your immune system. Your immune system is going to affect your hormones and your neurons and your psychological. So everything is all combined and is dependent on each other to function well. And what we're seeing now in unprecedented levels is just a breakdown of our overall health. All right, so what is stress? So the whole purpose of stress is to keep us alive when there were saber-toothed tigers trying to eat us. So we needed something very, very powerful to keep us alive when there was things around that wanted to kill us. Now, at least in this country, right, there aren't really things around that are going to kill us for most of us, right, thankfully. But we still are all succumbing to this chronic stress cycle, right? We're all stressed out, but really we should only be stressed, right, when there is a threat to our survival. And there are two parts of the brain that I really focus on in my research. And when I do talks, it's this prefrontal cortex and the amygdala, right? And we'll explain that a little bit. But when the amygdala is turned on, right, this is when you're in your fight or flight. This is when we're quote unquote stressed out. You release a lot of chemicals, which again are good for about 30 minutes at a time. This is what all the studies tell us. We can be in this fight or flight for about 30 minutes at one time. But the chemicals, primarily glucocorticoids, right? This is a chemical that really mobilizes our body. When they stick around too long, they can lead to things like chronic pain, chronic emotional issues, troubles with our memory, right? And our behaviors will change when there's too much stress going on. Now, when I talk to patients, I'll often draw something like this, not nearly as good as this, right? But I talk to them, all right, we're going to talk about your brain later, or your mind later, but right now we're going to talk about your brain. So the brain versus the mind. The brain is the hardware, the mind is the software. The brain is the phone, the mind are the apps. They work together, but they're very, very different. And this is definitely an oversimplification, right? But there are two major parts of our brain that determine our behaviors. We have this prefrontal cortex, which is right behind our forehead. This is what I call the human brain. Other people refer to the upstairs brain, the school brain, or for all you Marvel fans out there, the Bruce Banner brain, right? From the Hulk, right? This is a part of the brain that has allowed humans basically to take over the world, right? This is a part of our brain that allows us to stay calm, to stay focused, to interact well with others, right? To be organized, to control our emotions. This is a part of the brain that works based on fact, right? Not on fiction, not on emotions, right? Now, then we have these two almond-shaped things down here, right? Called the amygdala. And I call this the monkey brain, but it can be the downstairs brain, the primitive brain, the survivor brain, or sometimes when I explain to kids, this is your Hulk brain, right? So this is the part of the brain that still thinks it's 100,000 years ago and still thinks that there's saber-toothed tigers, right? Outside of every corner. So this part of the brain never wants you to be relaxed. It never wants you to be calm. It's always primed, and it can turn on in a split second and put you in a position that will help you to survive as if it were 100,000 years ago and there's something trying to eat you. So this is what puts you into your fight or flight, right? So there's this constant interplay between the prefrontal cortex telling you to stay calm, stay relaxed, let's think logically and calmly. And then this part of the brain, the amygdala, the monkey brain, trying to tell you the sky is falling, there's danger on every corner, you can never settle down. You always have to be hyper aroused, hyper vigilant, or you will be killed. Now, whenever this part of the brain turns on, it releases a cascade of chemicals that affects every part of your body. And we just said a couple seconds ago, is that when this part of the brain turns on, those chemicals optimize your body to fight or to run as if it were 100,000 years ago. So I think when you see some of your kids' behavior now, you're going to see how it can be definitely amygdala driven. All right, so first thing we talk about. So when the amygdala turns on, it dilates that black part of your eye called your pupil. And that happens because when the pupil dilates, it makes you more sensitive to light. So remember, this amygdala is only supposed to turn on if there's a threat around. And 100,000 years ago, we were most often attacked and vulnerable at night. So over time, the amygdala got to learn, right? So when we get stressed, it was a good thing to make our pupils big. And that was good, again, when you were being attacked at night. But in today's world, when the amygdala turns on, it still thinks it's a good idea for our pupils to dilate. But now, right, we get stressed not because of saber-toothed tiger, but because we get stuck in traffic or we're running late, right? Or we're in school and we have a big test coming up, right? Our pupils still dilate, but now we have fluorescent lights everywhere. We have screens everywhere. So this is where some kids, they blink a lot, right? Or at the end of the day, they have tired eyes, or even some kids, you think autistic kids, for instance, they have all this very significant light sensitivity, or patients after a head trauma. This is where a lot of their light sensitive comes from. It's not from, the head injury itself. It comes from the activation of the amygdala. And when we have head trauma, right, the amygdala, the right amygdala, the middle lobe lights right up. And that makes sense, right? 100,000 years ago, if you got a concussion, right, you wanted that amygdala to be turned on because you need to fight or to run because there's likely something trying to kill you. But today we get concussions and, it's an ice rink or it's in a parking lot, right, on a ski hill, right? So there's not a threat to our survival, but the amygdala doesn't know that. It just shoots us immediately into this fight or flight response and makes our light sensitive. Now, some people have no light sensitive, whether it's concussion or in life, but it's sound sensitivity, but it's for the same reason, right? If there's a threat around, you want to hear it. So part of what happens when the amygdala turns on, it makes our hearing more sensitive, which again is good when you're listening for a saber-toothed tiger creeping through the grass, but not good to have sensitive hearing, when we have 7.5 billion people in the world, when we have devices with volume buttons on, when we're jamming 30 kids in confined areas in classrooms, there's a lot more sound than there ever was before. So this is where some people get ringing in the ears or the hearing sensitivity. Now, the problem with the amygdala too is it turns on not only when we're injured or when we're stressed, but it turns on whenever something is new, whenever there's a change. Because remember, 100,000 years ago, right, something new, something different, well, that was a threat to your survival. So this is the first feedback loop that we talk about. If your amygdala starts perceiving too much light and too much sound, the amygdala is like, oh goodness, this is not good. Too much light, too much sound, this is wrong. There must be danger around. So it stays secreting all those chemicals that are going to keep your pupils a little bit too dilated, keep your hearing a little bit too sensitive, right? Now, some people with a hyperactive amygdala, right, they don't have any problems with their light or their sound, but they have problems with sleep. And that makes perfect sense too, right? Because remember, if you're in your cave and there's something outside of your cave that might want to eat you, right? So there is a true threat to your survival around, thus turning on your amygdala, then you better not fall asleep. So this is where a lot of our insomnia comes from, whether we have a head injury or not. We have a big presentation at work the next day, right? Well, that makes our mind a little bit busier, right? So we don't fall asleep. Or for kids, this is why they need to sleep with their parents. Where's the safest place for them to be according to their amygdala? Well, with their parents, right? And nighttime is hard too, right? So we've been programmed to be a little bit more cautious at night, right? So that's why a lot of kids do have problems with sleep, because sleep or nighttime is dangerous. And so your amygdala is going to be a little bit more turned on most of the time at night. And then also with all the distractions from the day, right? Normally our mind is pulled in 16 different directions at one time, right? Well, at night, that's gone and you're just left with your busy mind, right? And what happens if we don't sleep really well? Well, our focus is going to be worse. We're more likely to have pain, right? Our emotions are going to be out of whack, right? So sleep is incredibly important. We're going to talk about that a little bit later. Now, what else does the amygdala turn on? Well, it makes your muscles fire, right? And that's good if you need to fight or to run, right? But when we sit on our chairs, 6 hours a day, to have a busy mind that causes our muscles to be more engaged, more tight, well, that's not a good response anymore. And so this is where some people bite their nails a lot, right? Or they pick, right? Or they twiddle their hair, or they scratch themselves, or they get out of their chair and they have to pace and walk around. It's that amygdala giving their more energy to their muscles. For me, it's my leg shakes. So I don't often feel stressed, right? But for me, I know that my amygdala is turned on when my foot starts to shake, right? I think a lot of us can sympathize with that. There's something where, we just become a little bit more fidgety, right? We start twirling our pens or our pencils, right? We kind of adjust ourselves all the time. Also, what happens, so when the amygdala turns on, it makes your neck and your back muscles get tighter, right? And there's studies that show that when your amygdala is turned on, you're more likely to turn from your hips than you are from your shoulders, right? And that's, again, good for 30 minutes at a time to support yourself, right? If you need to fight. But when you're tight day after day, week after week, well, this is where people develop chronic neck and back pain from. Now, when the amygdala turns on, right, it shunts blood away from parts of your brain that you don't want working in a life or death situation immediately. So it actually does take a little bit of blood away from your brain to fuel your muscles. So we know that stress causes a little bit of what we call vasoconstriction, so less blood going to the brain. When you start messing with the blood that goes to your brain, right, well, that's going to give you headaches and dizziness. And that's where they say, quote unquote, stress is the #1 cause of headaches. It's not so much when you're stressed, but it's when you're a little bit more relaxed after. Those blood vessels in your neck open up a little bit, you get a surge of blood, which gives that increased pressure, which causes your headaches. Now, the two amygdala, actually, they communicate quite closely with a nerve called the vagal nerve. So vagus is Latin for wandering. So we have a nerve that goes pretty much from the back of our brain right down to our belly. And so that's why you might be hearing a lot more about the brain and the mind, the brain and the belly communication, because they're directly linked. But this is why up to 80% of belly pain in kids in pediatrics, we don't find a cause. The pain is real, but it doesn't come from the spleen or the liver or the pancreas. It actually is like a headache, and it comes from a nerve that travels straight from the back of your brain down to your belly, called the vagal nerve. Because again, when you're in a fighting situation, you don't want to be wasting resources on your digestive system. So the amygdala controls what we know is that fight, flight, or freeze, whereas that vagal nerve is called our rest and digest nerve. They're opposite. So interestingly too, for adults more so, is that the amygdala through the vagal nerve also communicates directly with the heart. So the vagal nerve actually slows down your heart. But in a time of a fight or a flight situation, the amygdala turns on. Remember, it turns off the vagal nerve. So essentially, you're taking the brake off of your heart, which is why we get that crazy heart beating, right? Which again is good if you're trying to pump blood to your muscles so you can fight or run, but not good, right? If you're stressed out and you get chest pains, well, this is where a lot of people go to the ER, every day thinking they have a heart attack, but it's not. It's just the heart's beating quicker from the amygdala in this fight or flight response. And then the last thing, unfortunately, that the amygdala does, and this is probably the most troublesome, is that the amygdala can turn off the prefrontal cortex. So they've done studies when people are stressed, they look at brain activity, and when the amygdalas are turned on, the prefrontal cortex goes off. And that's makes sense, because if there's something trying to kill you, you don't want to be calm and relaxed. You want to be irritable and angry and, and just want to fight or to run, right? So you might think the prefrontal cortex, that kind of sounds familiar. It's like, ADHD, right? So kids with ADHD has nothing to do with intelligence, but kids with ADHD, that prefrontal cortex is about 2 years delayed in maturation. And so that's why it can be very hard to figure out, does this kid with significant behavioral issues, distractibility, impulse control, poor executive functioning, we call it, does he have ADHD, which is a structural deficit, right, in the prefrontal cortex? Or is just this a kid who's been through trauma or has stress or anxiety that the prefrontal cortex would be formed correctly? It just doesn't function, doesn't fire correctly. So for me, it's like when I run late in clinic, right, that stresses me out. Right? My prefrontal cortex shuts down, and you would swear I have ADHD. I'm more distracted. I'll run back to my office, forget why I went there. I'll ask the same questions. I'm a little bit more irritable, right? When I run late, and I don't have ADHD, so my prefrontal cortex is a little bit shut down. So that's one thing that we see a lot of. And as pediatricians, we do a lot with ADHD and anxiety now. And it's just kind of interesting to some to see that this is what's happening. So you might swear your kid has ADHD, but that's not it. Right. And we're going to talk about how technology plays into this as well in a couple minutes. So when I talk to patients, I talk about the mind first, and I explain that my drawing ability peaked when I was about 3, and I draw them that very crude brain. But then I say, all right, now we're going to switch to the mind. Right. And so this is that Hans-Selye general adaptation syndrome I alluded to before. All right. So what I want for all my patients is to be in this green zone. So this green zone is when the mind is calm. There is no stress. There is no anxiety. You're thinking with the prefrontal cortex, that front part of your brain. So this means that, again, no stress, no anxiety, no previous trauma. It means you're not thinking too much about tomorrow. You're not thinking too much about yesterday. It means that you love school and school loves you, and you love home and home loves you, and you're eating well and sleeping well, and you don't have too much technology, right? Not trying to please everybody, not trying to be perfect, right? You're just calm. Now, yellow phase, right? So the yellow phase, this is the stressor. This is anything that the amygdala, right? Your monkey brain, I explain it to kids too, like your spidey sense, for those of you, again, that know Spider-Man, one of his superpowers is he can sense danger. Well, the amygdala is always looking for danger, and it's going to find the danger even if it's not there. So anything can turn on the amygdala. I had a kid the other day, it was butterflies. Butterflies would make this kid a flight risk. So butterflies are not dangerous, but the amygdala, right? As long as the amygdala turns on, faster than you can even see, you go from threat to fight or flight. And so this is your classic fight or flight that Hans-Selye describes as a resistance phase. So this is when you're in that hyper-aroused state. And we're all programmed. This is what the studies show, is that you can be in this orange zone, high in orange zone, for about 30 minutes at a time, which again makes perfect sense, because if you fought for 30 minutes, right, 100,000 years ago, you either killed something or you were dead. If you ran for 30 minutes, right, well, you were out of trouble. It's when you spend too much time in this orange phase, day after day, week after week, month after month, year to year, you burn out. And this burnout zone, this is an hour in talk of itself, but this is when we're just exhausted, we're tired. This is where, for me, it's prolonged post-concussion syndrome. It's also like fibromyalgia, chronic fatigue syndrome. This is just your body starts burning out. In pediatrics, we see it in kids whose eyes don't track well, or they get super dizzy when they go from sitting to standing, right? Or they have pain amplification. This is where your neurologic system just doesn't function well, right? So what I try to get people to do is get as much time in this green zone as you can, or harm reduction, keep you in this low orange zone. So I tell patients I am a low orange phase guy. So what does this mean? This means that my mind was always busy, right? I didn't have stress, right? I never had stress as a kid. I was a really happy, relaxed kid. But when I was 8, I knew I was going to be a doctor and play in the NHL by the time I was 12, right? Happy kid, just busy mind. And every memory I have through elementary school and high school, my foot was shaking, just bop, 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 bop all the time, right? Just planning ahead and thinking. Now, I am not, right, I would say a stressed out guy, but definitely my mind wasn't as peace as much as it should be. You know, a family member of mine, you know, she's an orange phase girl, not that she wants to play professional hockey, right? But she's a bit of a people pleaser, right? Which isn't a terrible thing, but her mind is constantly busy and spinning, worrying about other people, and just this great sense of empathy that she has, right? Now, this is what we call, you know, more of a subconscious level. So I wouldn't say she has anxiety, stress now, but, you know, we got our eye on her. When you go higher in this orange zone, right? When you go higher in this orange zone, this is where you start to feel it. So this is where you start feeling a little bit stressed. Like when I start running late, this is what I feel. So this is going to be a little bit more of the, you know, the gut turning, the sweaty palms, right? This is going to be a little bit of, you know, bit more irritable, right? But again, you can slide nicely back into this orange zone, back into this green zone. Right. But it's when you start getting higher in this orange zone, this is when most of your thinking comes from that back part of your brain, your amygdala. So this is where, you know, you have a hard time ever relaxing. You might have anxiety or stress, right? And then the higher you go here, the quicker you burn out, right? So yeah, that's about the mind. And so what we know is up to 80% of people now are in this orange zone, and most of us don't even realize it, right? Whether it's high or low. It's just an interesting study that was done years ago where they took a bunch of office workers, 40-something office workers, and they just, they knew they were going to be part of a study. They didn't know what the study was, right? But it was basically to annoy them, right? So they brought in this thing that made some sound, and they checked their blood pressure, their heart rate, their cortisol levels, right? At the end of the day. And then they asked them, did you feel stressed or irritable? And they said, no. But you looked at them and no, their heart rate was different. Their blood pressure was elevated, and they had cortisol, which is your stress hormone, in their urine. So point of this was that a lot of us are in that orange zone and we don't even feel it, right? But it still affects us physically, right? So I do talk a lot about the subconscious versus the conscious, right? And so our consciousness, I've read, can process about 40 pieces of data at one point, right? So any thought or any feeling that we have that we're aware of, that can process about 40 pieces of information, the subconscious. So what goes on, all the brain activity that goes on that we are not aware of, that really kind of either drives us into that orange zone or that green zone, can process 11 million, right? So any feeling or thought, I tell patients, it's the equivalent of like a snowflake on an iceberg in terms of what's really going on in our brain. So it's just something to think about. And yeah, this is just talking about how that old stress response that was so crucial to our survival, right, for hundreds of thousands of years, actually creates this cycling effect, right? And so when we get stuck in that cycle, and again, if anybody's really, really keen, it just talks about here how chronic stress and the chemicals that release really just mess with our brain, right? Over the long term, how it eats away at certain parts of our brain, right? And so this is kind of like the concussion cycle. And again, just a couple of other studies out there that how stress does lead to chronic pain and fatigue and how it does affect our memory. So when we talk about concussion or any sort of trauma, right, this is kind of what happens. So you get a head injury and that turns on the amygdala, but it could be any trauma, right? It could be an abusive relationship, right? It could be, a difficult teacher, even for that matter. It doesn't matter. Anything that's going to turn on that amygdala. And that amygdala turns on, well, and like we talked about before, that's going to affect your sleep. If we're not sleeping really well, it doesn't take long for that to affect our focus, our concentration, our mood. When that starts to happen, well, that affects school. When school starts not going really well, that causes more stress. More stress causes harder to fall asleep. Harder to fall asleep can cause more headaches, which causes more stress, which causes more problems with school, which causes more problems with home life, which causes more problems with sleep, which causes more problems with stress, which causes more problems with headaches and fatigue, and you just cycle, right? So what we try to do is break that cycle, right, as much as we can. And we're going to talk about that later, but everything that goes on really is cyclical, as you'll see. And so this is another version of what we were just talking about going into that red phase. This is from Bruce McEwen, a Harvard guy. He really popularized it after Apple's kind of introduced it. The allostatic load basically talks about how much stuff we're dealing with. The more stuff that we deal with, the more kind of crap going on in our lives, right, is eventually going to burn us out. So whereas Hans Selye describes it as decompensation, Bruce McEwen called it vital exhaustion. I call it neurologic exhaustion, right? Neurological fatiguing. But basically, right, it's how much crap we're going through. Now, who are the people that don't recover from post-concussions or from a concussion, right? Well, it's the orange phase people. Right? It's people that are already in that orange phase, right? But this is for life too, right? Remember, a concussion could be considered a yellow phase thing, a trigger, but a trigger could be absolutely anything. And so what happens though, is when you're in this orange phase, right? So you could be somebody that has pre-existing stress or anxiety, or somebody that wants to be perfect, right? Or somebody that, again, that's just going through a lot of crap, right? Somebody that has a high allostatic load. Well, they're already in this orange zone, right? That amygdala is already primed. It's already working. So when they get hit, they don't go from a calm, quiet amygdala to slightly elevated. They go from an elevated state to really elevated, right? And when that amygdala turns on, everything is worse. Stress and thinking, right? And sleep and interpersonal relationships, right? And the higher you go there, the quicker you go down there, right? But this is life, right? All right. And this is another thing too that we talk about a lot. Like a lot of people come with concussion symptoms, primarily being cognition. I can't think like I used to. Well, and after a long, song and dance, and now we're talking to them, I think they do see it that, yeah, the head injury can start it, but that rotation of the head that produces a concussion isn't going to lead, for most people, right, years worth of cognitive problems, thinking problems. But what happens is, all right, you get that head injury and that causes some stress, or you have any other trauma, and that makes it harder to think. Well, harder to think, whether at school or work, right, puts more stress on you. Well, more stress makes it harder to think, which causes more stress, which causes more problems with thinking, which causes more stress. So that's another cycle too. And KAL 1992, right, called that the negative cognitive loop, right? So just an interesting concept for us to all be aware of. Now, technology. Why has my practice changed so much over the last few years? Well, everybody's in the orange phase now, like I said, up to 80%, right? And studies have shown through history, it used to be about 12 to 18%, but now 80% of kids are caught with this overstimulated, busy mind, right? I'm going to talk about this a little bit here. So 50% of teens feel addicted, right, to their mobile devices. And that is, when kids actually feel it, like anybody that's dealt with addiction, most people don't feel addicted for a long time. So the fact that 50% of teens feel addicted, right? Well, that says something. 58% of teenagers can't go 10 minutes, right, without looking at their phone, right? But you're seeing what smartphones have done over time, guys. And again, we're making a point with smartphones, but this is technology, handheld technology in general, right? You're seeing, all right, introduction of cell phones, not hanging out with friends, not driving, not becoming socially connected, not dating as much, right? Feeling more lonely, and sleep is getting a lot worse as well too. So these are all things that just happened in the last, since 2007, but really in the last 6 or 7 years. So up to 80% of kids feel daily stress now, right? And so this is the diagram that I made here too, right? It's just kind of an example to see, all right, traditionally, if you look through the literature, about 10 to 18% of the population had some mental health issues, right? Stress, anxiety, depression. And, you know, a lot of things happened in history that didn't change this. 2007, launched the iPhone. Shortly thereafter, boom, you're starting to see all these different things. You're starting to see ADHD going way up, long-term concussion, anxiety, all these things are just spiking, right? And we're seeing the effects of it now. So what does the technology do? Why is it so bad, right? Well, when people are on their devices, right, we've done studies, we see that it does light up two very important parts of your brain. It does light up your stress center, right? And it does light up your addiction center, your nucleus accumbens, right? So this technology is very addictive, right? And so, you know, people, I always tell patients, so I lived in Albuquerque, New Mexico for a while, which they filmed Breaking Bad. So we've seen meth, right? We've seen people addicted to meth. I lived in Boston, right? And Boston has a cocaine problem, right? Amongst others, right? But I can tell you that there's not much of a difference, guys, when you try to get a kid off of methamphetamine, when you try to get a kid off of cocaine, and when you try to get a kid's device away from them, right? Tell me if this sounds familiar. The first thing is denial, right? With technology and addiction in general. I don't have a problem. You know, I've seen people with no teeth, right? Not thinking that meth is a problem for them. I've had people drop out of school, right? Because they needed money to support their drug abuse and in denial about it. I've seen kids with 6 or 7 hours of screen time a day, right? Failing school, right? Having huge anxiety and stress. Saying, no, it's not a problem for me. Not a problem for me. Right? So that's stage one, is denial. Number two is justifying, right? Justifying why we need to do what's addictive. Right. Well, for the drug users, it's because it makes them feel good. It relaxes them. Right. Or it's because it's all what their friends do. Like there's always an excuse. Right. Gamblers, it's the same thing. It's not the substance. Right. Gamblers, I need to do it because I need to make money. Right. Screen time. Yeah. I mean, especially during the pandemic, it was hard. Right. I need to do it because this is what friends do for school. So, I mean, that's why we're having a lot of problems. Right. And then the third is anger. You try to pull anyone's screen away from them. Right. And their personality changes. So my brother-in-law is a police officer, and he says, you work a night shift in suburbia, you're going to get a couple of calls about how a teenager is losing their mind, attacking the house or attacking the parents because the parents have the audacity to turn the Wi-Fi off. Right. That's addiction, guys. And the 4 stages: bargaining, negotiation, trying to get back. Right. And, guys, we might even see some of these patterns of behavior in ourselves, right? And our loved ones that aren't kids. Right. So what else does a screen do? It overstimulates the mind. There's something called a novelty bias. Our minds like to learn. That's why humans have taken over the world. We like to learn, right? We like to learn. But up until a few years ago, right, we didn't have something that was going to feed that need, right, constantly. Like when I was a teenager, I was a big geek, right? I remember biking to the library with a pocket full of dimes to photocopy things. Now you want to know something, right? You just Google it and it's right there. So what I tell patients is I would have never made it through med school had I had a cell phone. I would have been wicked smart by the time I was 19 or 20, but my mind would have never settled down and I would have gone into that red zone, right? Not a doubt in my mind. And then the other thing I kind of think of is this on-call effect. So on-call means that, like, as for doctors, right, we carried a pager and, nurses or other doctors or hospitals could call us 24/7. So I remember right out of med school, we would work 30 hours straight. So 30 hours, you'd carry these kind of pagers. Or 24, but you had to be out 6 hours later. But I digress. But they realized that being on call like that, right, had a very negative impact on our mental health, right? Imagine that. So they actually had laws to say, all right, you can't be on call for this now. But look at our kids now, right? When we were younger, we want to talk to somebody, we either bike to their house, we had that landline thing with that cord attached to the wall. Right now, people can get a hold of our kids 24/7, text them, call them, post something about them, heaven forbid not post something about them, right? Not like their pictures, right? Their mind just can't shut off and it causes burnout. So we're seeing 15-year-old guys with chronic fatigue syndrome, fibromyalgia, conditions we talked about before that used to take 40, 50 years to develop. We're seeing in teenagers after 10. It's crazy. All right, what else do screens do? I thought this was a very funny quote here too, but they disseminate just information, but it doesn't necessarily mean it's good information, right? Anyone can post something. There's no filters. There's no fact checking. Even a lot of the reputable news agencies, there's a rush to get out to things out there. So they're just throwing all this information and they're biasing society, right? So there's huge disinformation just going on, right? And just people's minds and views are being polarized, and it's a big, big problem. But that's not the point of talking today. All right. So what can we do about all of this, right? Promoting some digital resiliency and preventing tech addiction, right? Show and teach your kids what is important in life, right? So connect to people, right? So playing Fortnite with somebody in Berlin, right, does not give you the same kind of endorphin rush that being face-to-face does. And this is, again, why COVID was so bad for so many people, the online learning. And we feel better when we're with people. And this, guys, I'm a big fan of evolutionary psychology, right? Like the way we think now is based on how we lived our life for hundreds of thousands of years, right? And so what's happened really, the industrial age and this information age now that we're talking about now, our minds haven't quite caught up yet, right? So we still really, really need to be with people, right? All right. Now, when we have moods and feelings, right, how to connect with your kids, right? And this is something that, again, as my kids reach their preteen years, right, it's very important that you understand their feelings, right? And you validate their feelings. And we're going to talk about something called cognitive distancing in a few minutes, right? But it's important for feeling to be connected, whether it's about, tech or not. It's you really want to have those open lines of communications, right? That's super, super important. Right? You want to use empathy, validation, and support, right? Again, don't start with just giving advice. You have to listen to them, validate what they're feeling, right? And this is something that we all need to do to check. And again, I know we're supposed to be talking about, tech, but this is about, improving our kids' lives, right? And so really connecting with them, right? Don't be judging them, right? And just as an aside, there's a couple good authors I like out there, guys. Dan Siegel. He's a child psych. He writes some great books, The Whole Brain Child, No Drama Discipline, really, really good. Ross Green talks a lot about some good books. He has an ADHD slant to it, but, really good. Dan Siegel, really like him. So you can look at him. So again, family time, guys, right? And this is something where I think my family hates, right? But it's eating family dinner. This isn't just kind of hearsay, guys. This is studies have shown this, right? That eating dinner as a family is an incredibly important activity to increase social bonding, to make us feel more comfortable with each other. And it's amazing the things that can be discussed, when we're eating, right? So try to make it a point to get that 30 minutes where you're just sitting together and you're bonding and your tech is away and you're just really kind of connecting with each other. Right. So yeah, this is kind of a nice segue into here. So we're only now seeing the effect of, technology on the kids, like this kind of generation going through now. This is the first one that grew up with it. And we really are seeing unprecedented levels of anxiety and stress, like we had mentioned before. So, the AAP, American Academy of Pediatrics, Pediatric Society, no tech before 2. Right. So much development goes on, right? And so much learning happens, through things not screen-based, like the tactile things, touching and feeling and connectedness with family. That's so crucial that screens don't get it. There's some companies that marketed, baby Einstein and all these things. And when you actually really looked at these, the development of these kids that were given, all the screen time, they actually had huge developmental deficits, right? So screens, do not increase intelligence and development like we used to. It's doing it the old-fashioned way, right? Connecting with people, right? It's their tummy time. It's playing with the blocks. It's those kind of things. Cause and effect, not just watching something flash on a screen. That's not how our ancestors learned. That's not how we learn. So tech-free time, right? So we'll talk about this a little bit later, but as we get older, what we call the toxic screen time, 2 hours a day, 1 to 2 hours a day. Right. And that's not my opinion. That's what studies show. Right. And so when I get kids that are on, 7 hours a day, I said, listen, right, this is an addiction. Then you going cold turkey is probably not going to go well for you. So this is what we're just going to do. Take one chunk of time, maybe 6 to 7 p.m., a time where normally you're on your devices, and just start with an hour away from it, right? You can send out like a text bomb and just say, you know what, I'm tech free for the next hour. Just start with that, right? But again, some other tips here you can see too when your meals, have the TV turned off, right? In the car, try to stay away from the DVDs, right? Use that time to connect and talk as well too. I know it's hard. The easiest thing, right, to keep them not from fighting is, right, to put something on the screen, but try to use that time. Play some of the old alphabet games or I Spy, right? Those are great opportunities, right, for us to connect with our kids, right? So yeah, and even talking about having that little device bowl at home, right? So for me, we don't have a device bowl, we have a drawer, right? So when we get home, right, we put my phone in a drawer, right? I try to do as much as I can, right? Because again, I don't feel addicted to my phone, but I know that I'm addicted, right? Like most of us are, because if I leave my phone on the kitchen counter, within 30 minutes, I'm checking emails, right? That's addiction. Or sometimes even going between patients, my hand would reach into my phone, right? And that's just how our minds are wired, right? So put that phone away. And when I do reach for my phone, I say, I'm feeding my addiction, right? Or I ask myself, do I need to do this? So I do this with myself, right? Because we're all vulnerable to this, right? Again, when you don't kill time, right? Use every little opportunity, right, to connect with your kids. There's so few, time goes by so fast, guys, right? I think all us young parents will realize that my kids are 9 and 11. I can't believe how fast it's gone, right? And it's scary that, in the next few years, they're going to want even less time to do it, right? As they transition into that 12, 13, 14 year. So I try as best I can to capitalize, and, they hate me for it because they know, like, I'm the tech sheriff, right? That, whenever I see them on the screen, I try to get them off as much as I can, right? Again, so there's little games that you can play too, is the phone stack here with friends. You go out with friends and, you can just put it in the middle. The first one that grabs the phone loses, right? And even have the first one that grabs their phone has to pay for the dinner for everyone else. There's little things that you can do, right? But just try to connect with each other. And it'll be amazing, guys, when you're there, you can see how hard it is for us not to grab for our phones. And I'm just going to take a picture, right? Or something, it might be something important. You'll be shocked to see how hard it is not to grab our phones, right? Again, this is just going back to no screens at dinner time. Connect to other activities, right? No. So I've been studying a lot, or reading up a lot about happiness, right? And Viktor Frankl, he wrote a book a long time, Man's Search for Meaning, about the Holocaust, right? And what studies with happiness shows is that, and again, it sounds cliche, but money doesn't buy happiness, right? Objects don't buy happiness. We chase it because it gives us that dopamine hit. We hit Amazon, we hit buy, boom, get a little hit of dopamine, right? Makes us feel good, right? But that doesn't lead to long-term happiness. What leads to long-term happiness is actually giving to others, right? Volunteering, altruism. And this isn't just hippie stuff here. This is actually science-based. Helping others makes us feel good. And if you think of it through an evolutionary psychology standpoint, when we helped, our tribe, right, that was good for all of us, right? And that kind of thing does reinforce us, right? Reinforces these behaviors, making us feel good, right? So sleep is incredibly important. Like we talked about this, right? And I know this is hard, guys, and I've been fighting it at my house for the last 2 years. There should not be devices in the bedroom, right? Should not be devices in the bedroom. And so it's almost like if you're an alcoholic, just having a beer bottle there, right? Or having a Proline ticket for the gamblers, right? Just having it there keeps that mind going, right? And it makes it harder to fall asleep, and it gives you broken sleep. Right. So it is really hard. I remember I had one kid that was referred to me for sleep problems. And first question, is there a device in the room? And the mom got mad at me. And she's like, it's not the screen. Every doctor says that. It's unplugged during the week. Right. I said, just humor me. Please take it out. And it was in a little cubby. And I said, just even put a blanket over that little cubby. Right. And sure enough, they came back 2 weeks later and he was sleeping fine. Right. So I asked mom, do you think that your kid's subconscious, right, has any notion that TV is unplugged? No. Whenever there's an addiction there, the mind searches it. And that's the devil of addiction, always trying to search for it to get that next dopamine hit, right? All right. Physical activity, and even physical activity in nature is even better, right? Remember, evolutionary psychiatry, we're supposed to be around in nature. Nature with exercise is the best combination, right? So this is just, 10 hours a week, guys. I mean, it seems unheard of. How can we ever do it? Well, I mean, there's a reason why the Scandinavian countries are among the most happiest in the world. They really promote, right, outdoor activities, right? And again, trying to get them into other things, right? Just playing outside, getting into hobbies, getting them into activities. They don't necessarily need to be organized, but, just get them to latch on drawing, music, anything like this. Try to get them away from their default, right? All right. So these are two concepts of all the kind of psychological mumbo jumbo that I talk about. This is the two things that I want people to realize. And I hope that this comes across okay in this kind of short setting. Number one is cognitive distancing, right? So what does this mean? Separate from thoughts, right? So whatever thought that any of us have, guys, right? It's very, very real, but it's not us, right? It's not necessarily true. So I say it's not true and it's not you. It just comes from one of these two different parts of our brain, right? And so when we can separate that, if we can think, all right, this thought's coming from the monkey brain, right? So I always talk about my kids, is this your monkey brain? Is this your human brain? When you name it to tame it, right? If you say, this is the monkey brain, take a couple of breaths and you let it go, right? And the analogy that I like, it's like, you're waiting for the bus. When you wait for the bus, you don't jump on the first bus that you see. That first bus will probably take you somewhere you don't want to go. Our thoughts and our feelings are the same for all of us. That first thought that pops into our head, about 70 to 90% of the time, guys, science tells us, comes from our amygdala, our fight or flight center. So if we grab onto that thought that just pops in there, this isn't fair, this is stupid, I can't do this. If we hold on to that thought and believe it to be true, then it's going to take us somewhere we don't want to go, right? So separating yourself from your thought, but it's a skill, and I'm constantly trying to do it. The other thing for all of us to remember is this internal locus of control, right? That up to 90% of our happiness comes from us. We own it. What goes on around us, what happens to us, guys, only owns 10% of our happiness. So that I tell kids, that bully at school, right? That bully only controls 10% of your happiness. Don't give them more. And so it's always like, thinking about that up to 9% of our happiness, we control it, guys. So I'll give you a stupid little example here that I give kids, right? I know I might be running a little bit long here, but so the thing that really stresses me out is when I run late, because my perception of running late is that it's rude. So when I start running late, again, I have ADHD almost, right? My foot's shaking, I'm irritable, I'm getting a little stressy, I'm repeating myself, right? My wife, not a rude person, right? She has a different view of running late. She's like, it's good to run late. It gives other people more time to get there, right? So our external world is the same, right? We're both running 20 minutes late, right? And I'm freaking out, right? I'm sitting in the car waiting I can't say anything to her because we'll get in a fight, right? So I'm sitting in the car, my foot's shaking, I'm grinding my teeth, right? My eyes are blinking, my palms are sweaty, my stomach's turning, I'm angry, I'm frustrated. And she's just sitting in the kitchen drinking her coffee, right? So our world is the same, but what's different? It's one perception, one thought, and whether it's conscious or subconscious, that's what we all have to focus. What's driving us? What's making us angry? What's making us, sad, right? It's a thought. And when you can separate yourself from the thought, it doesn't matter what happens to you. As long as you learn to let things go, right? And as long as you can look at things from a different perspective, right? Then that's when we're happy. And that's the problem with things like technology, right? It turns that part of your brain on, so you can't let go, right? It stimulates that part of the brain, right? And that makes you start seeing the lens through a very negative, pessimistic way. So you start seeing the world is out against you, or things aren't fair, right? Or you can't do things. And that's just all coming from your monkey brain, right? So those are some really tenets, right? For our kids, guys, I'm trying to speed things up here now. Try to enhance their resilience. Lots of good books out there. Their ability to overcome obstacles, right? So much as parents, we want to kind of cuddle them, right? And protect them, right? I'm not saying you can't do that, but you got to give them the confidence and the skills to overcome obstacles, because we're not going to be there forever. You got to have them, help them, handle a bad teacher, a bad boss, right? You have to be able to give them the strength to, fight through a difficult breakup, right? And that's resiliency. And there's lots of books out there enhancing resiliency, right? Strategies, what you want to do for coping strategies, guys, and enhance a growth mindset, not a fixed mindset. A growth mindset is temporary, whatever this bad situation, I'm going to learn from it, or it's going to make me a better person. I can get through this. I can learn. Fixed mindset, nothing changes. I can't change. The situation's not changing. You need growth mindset. Right? So the best advice that I can get, learning how to control your mind, get in that green zone. But in the immortal words of Kermit the Frog, right? It's not easy being green, right? And I just want to say, this is how I treat patients, guys, whether it's for ADHD, anxiety, back pain. I take this 3P approach, right? This is kind of the chronic pain mantra here. And I'll just be very quick, right? So again, 90, this is a really good book. Sean Aker, easy read, guys. It's a good book, right? Breaking this cycle. So from a, trying to go through psychological, here we go. So there are 3 rules of 1, right? What does that mean? 1 hour physical exercise every day, maximum 1 to 2 hours, right, of toxic screen time, right? So that's school time, not great for you, but not toxic. Family screen time, right? That's okay, right? But get them away from TikTok and YouTube, the iPads, the tablets, all those things, right? And then it's never too early for me to get people in some sort of counseling, kids, like art therapy, get to increase their emotional intelligence, right? The second one that we talked about, so we talked about 1 hour of exercise, 1 to 2 hours of screen time. And the third is 1 act of mindfulness, mind training. When I say mindfulness, now teenagers' eyes roll back in their head, but mind training. So doing things like a gratitude journal. I get my kids to do it twice a week, right? Taking for a walk in the woods without earbuds in, or doing a little bit of meditation or yoga. The second P, so when you're dealing with anything, just think about the allied health professionals. Is there anything there that can help you, right? So massage, occupational therapists, physiotherapists, speech therapists, weighted blankets for kids that have trouble sleeping. Some kids love them, some kids hate them. There's just a lot of opportunities, but just again, to make you guys see that these are possible options to help your kids, right? And then the pharmacologic, this is the third P, and those supplements versus the meds. And I mean, whenever you talk about supplements, you just got to be aware that it's almost a $40 billion a year industry with very poor oversight, right? So all the supplements and vitamins, you got to be very, very careful about that too. A lot of them, you don't know what you're getting, and the effect size, so how well they work, is almost negligible. But saying that, I do use some supplements, right? But mindfulness, science-based. What does mind training do? It increases the blood flow to the front part of your brain. It's been shown to increase athletic performance, academic performance, decrease anxiety, right? Help with stress, right? Mindfulness has increased the size of your hippocampus. Stress shrinks it, but mindfulness increases the size of your hippocampus, which takes memories from short-term to long-term, right? Mindfulness targets your insula and your cingulate, which control your perceptions, how you see the world, right? So I always say here, doctors have the reputation of pushing meds. We don't push meds, we push things that work, and mindfulness does work. Right. And so it's just a little far side that I'm sure I don't have copyright to, but anyway, a lot of talking there in a short period of time, right? And yeah, my brain is full. And so this is a quote that I often use. I use it, with concussions for a long time, but it's even with tech right now. So Winston Churchill, after a big battle, that everyone was saying that the war was over. And he says, this big accomplishment, this big win, is not the end. It's not even being the end, but it's the end of the beginning. I think that's with the technology now too. We're finally understanding what it's doing, but I got a long way to go to rectify this. Thank you.
Thank you, Dr. Goulet. That was fantastic. I know there's going to be so many questions about a lot of the content, and thank you for covering so much so quickly. And we really appreciate all the resources you gave us, because I know that's going to be some good books that I'll be definitely ordering.
Yeah, and there's lots of resources to be had out there. Yeah.
Absolutely. So I wanted to ask a couple of questions. And I don't know if you want to go back to the slides or if you just want to answer them as I ask them. But just a point of clarification, you had mentioned the concussion quite a bit through the talk, but there are other traumas that aren't necessarily physical that still activate the same parts of the brain, right?
Absolutely. Yeah.
So
yeah, great point. So, and that's why I talk about trauma. So how I got on this whole kind of, I guess, speaking tour and everything, it's trauma-based, and concussions, trauma, but so does neglect, so does bullying at school, right? It's all about trauma, and whether it's a concussion or whether it's a difficult experience of any sort, it's going to turn on that amygdala, and what happens after that amygdala, right, turns on, and how you're able to kind of work through it and process those emotions and learn to let things go. Any sort of trauma. And it doesn't need to be a big, huge trauma. You don't need to have some severe, issues with your parents. Just little traumas will turn it up too, like little slide comments that can cause it. And that's where something, if people are interested in this, reading up on the adverse childhood events score is a really, really important tool that we use for, determining the risk of actually illnesses down the road is what have you gone through as a kid? So there's a list of questions that has been shown to be predictive of certain health conditions that you might not think are related at all, but trauma as a youngster causes these things.
Yeah, what I find amazing is that it doesn't necessarily have to have a pathology. Your kid doesn't have to be, can come from a happy, healthy home and still have these minor traumas that activate the amygdala. Yeah. So,
that's why I think, enhancing the resiliency, right, is so important. And that's, I talk to, and this is, something I work with my kids and my patients. It's, getting understand again, that internal locus of control, right? That no matter what happens to you, right, you can control that. You own 90% of it, right? What happened to you? Yeah. And I've seen a lot of abuse victims, like a lot of abuse victims. And this is a conversation that, to help them heal, part of it is, learning to, as bad as it sounds, you got to move on. You try to let things go and try to see. So a lot of these kids that I see that were abused, well, they want to be doctors and they want to be social workers or psychologists. And I say, you went through the worst thing that anyone could ever possibly imagine. And you have every reason to, just fall apart. But, if you can try to look at it this way, that the world did to you the worst thing that could ever do to you, right? Ever do to you. And you're still standing. So the remaining 80 years of your life, right, isn't going to hold a torch to this. But can you imagine what a good doctor, what a better doctor than me you're going to be, or what an amazing psychologist, because you went through something so traumatic and dangerous. And it's only then, and again, it's not trying to diminish what they went through, because, oh my God, it's some of the stories I've heard is heartbreaking, but how can we pull these kids through, right? And it's trying to say, give them the strength and the resiliency, some way to pull through.
Thank you. Now, could you comment a little bit, because now that we're in COVID, there is still a lot of online learning. And I know a lot of parents are also thinking about, maybe online learning was a better fit for my child as opposed to in-person learning. I know those questions are coming up. Can you comment a little bit about screens when it comes to learning versus some of the apps or the games or the social media, and how we engage in tech, if there's a difference between these things?
Yeah. So a couple of things there. So we are seeing that, like, a lot of kids now don't want to go back to school, right? And when things become more foreign, right, the amygdala didn't like it, right? So if you've been out of school for a while, the longer you stay out of school, the more foreign it gets, the more quote unquote dangerous it could be. And that's why we're getting so many kids with separation anxiety and school avoidance, right? It's a big issue right now. And yeah, you're feeling comfortable, right, being in front of the screens, right? Because again, you're safe, there's nothing around. So why would you want to venture out? But again, big picture, you got to get over that hump, because there's, being with people, that's how we're truly happy, right? It's the same thing, when we talk about with other kids, kids say, well, why are you trying to take away my screens? It's the only time I'm in the green zone. I say, well, why do alcoholics drink, right? You drink because it relaxes you, makes you feel good. It doesn't mean it's good for you, right? So yeah, with this, I have that too. And I just tell patients, I said, you're going to, your kids way better than I do, right? But I say that it is a slippery slope to go down this path, right, where you're going to be, isolating your kid, going against what our whole DNA is has been kind of gearing towards, being with people and supporting each other. And you're isolating, and they're losing skills to interact. And, most people have to interact with people in the world, at least how we look at it now. And they're losing skills like that, making it hard to get back in the real world.
Mm-hmm. And when you were talking in general about screen time and limiting your tech, do you mean also, I know, for example, if you're tutoring online, or some other extracurriculars are still online, does that count as well? Or are you really?
My opinion, no. Yeah, no, I think, I think that the pros outweigh the cons in situations like that, right? And so what I tell patients is, so the toxic time, screen time, is kind of unsupervised, alone television time. I think it's the TikTok, it's the YouTube, it's the social media, video games. It is even texting back and forth, ping, 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 right? It's even, listening to music, right? If, you just go from song to song to song, I always tell patients, get a playlist and just play it, right? people say that, there's always excuses, right, about keeping it. Well, my parents won't buy me an alarm clock, right? All these different things. There's always excuses to use it, but you got to find excuses not to use it. But to your point, I say school-based screen time is okay, right? Although, even though in an ideal world it is in person, right? The tutoring, if it has to be online, that's fine. Even like cuddling, watching TV as a family, that's okay too, right? That family time is okay, right? It's all the kind of the unsupervised, solitary, I'm going to watch TV in my room, or I'm just going to take my phone up there and text back and forth to your friends. That isn't talking on the phone, it's fine, right? But again, we get these little types of dopamine hits every time that we receive a text, right? Or someone likes our Instagram photo or whatever it is, So
it sounds like really increasing the social connectivity around, even if you are using the screens, to make it a family event or an engaging event. Okay. It really shocked me when you said, 80% of people just function in the orange, even subconsciously. We don't appreciate that we're in the orange. Now, do you have any tips for parents to even spot this in their kids? Because now that you pointed it out, I think, oh my goodness, I'm probably in orange most of my time as well. So, how can my kids also not? Like, how do I catch it, and how can I de-escalate them?
So what I say too, it's always a very, very fine line. And I say, like, to be successful in this world, you have to be in that orange zone, right? You do. Like, we can, in our world today, as bad as it sounds, you need to have drive, you need to have ambition, you need to have motivation, but it's keeping at that kind of manageable level and making sure that there are lots and lots of times where you are truly in that green zone, right? When you're laughing and you're just not thinking, about tomorrow, and you're just in the moment, right? So some signs that you're seeing, and again, everybody's a little bit different, right? So, but when I see, there is something that pediatricians use. It's called the SCARED questionnaire, SCARED, right? And people can just kind of look through that. And it's not something that's too intense, but they say, oh, geez, my kid is very fidgety a lot, right? Well, that could mean something. Guys, my parents, or my kid gets really nervous when I'm not around. Maybe there is some stress or anxiety, but I didn't really think about it. But there are also some body measures, right? If your kid's biting their nails a lot, if your kid is shaking their leg a lot, right? They don't need to necessarily be anxious or stressed. For me, like, I don't get stressed or anxious. I get a little bit cranky, right? And so, even my own family says, Dad, you're being a little bit short now. And I said, oh, okay, right? And so it causes me to take a little bit of a check. But for me, even for myself, when my foot starts shaking, right? Often that's not accompanied by any sort of psychological feelings. But now I'm kind of aware enough that when my legs start shaking, that tells me, okay, my amygdala is starting to turn on. And so what I'll do when I'm in the middle of a patient, I'll just take a couple of breaths through my nose, right? Just a couple of breaths. Remember, increasing the blood flow to the front part of your brain. And if I do that, it's pretty easy to, relax myself again. But if I wait 4 or 5 minutes and I just let my leg keep going shaking, it's pretty much like clockwork. My personality changes after 4 or 5 minutes, right? And then another telltale sign for me is if I've been in that orange red phase too much for a couple of days, my left eyelid will start twitching, right? And that's something that tells me. So it's these little subtle signs that are different for everybody. Like I said, some people have light sensitivity, some people have hearing sensitivity, some people just have issues with constipation, right? So constipation comes from those tight muscles too. And so it's always being on the lookout for these kind of like pseudo fight or flight responses.
That's a really good point, because even in little ones, constipation, provided it doesn't have to necessarily do with diet, but if you're noticing it when it relates to school or daycares or stomach pains, we always, sometimes you get that from your little one that, I have a stomach ache, I don't want to go to school. Like, those are all really good kind of flags.
Yeah. And the constipation, it's funny, like years ago when I started, if a kid was constipated, it was primarily dietary, right? Mm-hmm. But now, because remember, when the amygdala turns on, when the mind is busy, all your muscles get tight, including your pelvic floor muscles. And you might be stooling every day, but you're not emptying, you're not spending enough time on the toilet. So yeah, constipation, especially over the pandemic, it seems like a crazy topic, how we got from technology and mental health to constipation, but it's there.
Absolutely. Well, these are all great signs for parents to at least have in the back of their minds, so that, awareness is part of the solution. If you're at least aware, you can, what
absolutely
you're looking for.
Yeah, right? Identifying it early. And if you can get these kids to develop that ability, that mind training ability early on, oh my gosh, guys, like 12, 13, 14-year-olds and that happens 12 or 13, 14, right? Remember 100,000 years ago, 14, 15, we're starting our own families, right? So we are geared at 11 and 12 to think our parents are getting stupider and stupider and our friends are getting smarter, right? It's not till we're 25 and our prefrontal cortex is done forming that, we get a little bit smarter again. So just be aware of that too. That's why Dan Siegel writes a lot about that. Firestorm is a book about teenage brains too. And so a lot of interesting stuff there.
Fantastic. So top three resources, because you've gone through wonderful, wonderful resources. I think what we'll do is we'll go through everything and put links in the bio so that parents can easily access all the different sources. But what are your top three?
So my top three, just in general in child rearing, would you say, or?
In general, just great things like you're a parent, I'm a parent, things that, you've come across that you just thought were really great, kind of the holy grail. It doesn't necessarily have to do with screens, but.
Just so a couple of things. Yeah. So Dan Siegel, I can give you a few of them. Dan Siegel's work is great. Out of UBC or British Columbia in general, they have some great mental health resources. Anxiety Canada, right? I think it's .com, might be .ca, great resource, right? For parents that have, it's not necessarily for ADHD kids, but there's a free parenting program called Rolling with ADHD. It just helps with kids that have some prefrontal cortex things going on. It doesn't necessarily need to be ADHD. That's a really good resource. For the younger kids, Breathing Like a Bear, Sitting Still Like a Frog. These are just little books that kind of introduce kind of mindfulness. Kids that have OCD, obsessive compulsive disorder, it's a really good book. And we're seeing a lot of OCD now, is Talking Back to OCD. That's a really good resource. And there are some good apps out there. It's ironic, right, that I'm promoting apps here, but Headspace is a really good app. Calm is another really good app that we like too. They cost a little bit, but I think it's a really good investment. Even there's some YouTube videos. Cosmic Kids Yoga for the young ones is good. Yoga with Adriene for the older ones is.
Oh, I like both of those. And just another one that's great for yoga for kids is Miriam Gates. There's a good night yoga and a good morning yoga, which is a book. So even if you want to stay away from screens, that book is really accessible and really easy to use, and all great resources. Awesome. Well, thank you so much for your time.
No problem, guys. I hope you got something out of it.
We got a lot. I think this is going to lead to even more webinars, because I think we just opened a can of worms, and there's so many other topics that could spring from this really informative talk. So thank you again for your time.
Awesome. Happy to do it, guys. Thanks for having me.
Awesome. Thank you so much.
Take care, guys.
Thanks. Bye.